Great. So, so we're a primary healthcare service, actually. We were established in 1987 in response to a parliamentary inquiry about sex work in the inner city of Sydney, King's Cross area. And it's an integrated primary health service which aims to prevent, treat and manage transmissible infections amongst sex workers, people who inject drugs, and crucially relating to this, at risk from a drug and alcohol perspective, young people. And so a lot of our work is the overlap between drug and alcohol issues, street-based lifestyle, and bloodborne virus and STI risks. So the model is it's a drop-in, it's anonymous, it's confidential, it's free, modelling the aspects of primary healthcare, so affordability, accessibility, acceptability, and equitability. And we try and evolve the service to changing needs. Obviously, in 1987, there were a lot of street-based sex workers around the King's Cross area. That's not quite so the case anymore, but we've adapted our service model over time. So in terms of numbers, we see about 4,000 people a year, of whom about a quarter of them are 25 or younger. Now, not every single one of those would be an at-risk young person, but because of the nature of the service and the nature of the organisations with whom we partner, a reasonable majority would be. So, as I said, it's a primary healthcare model, so we will see people for whatever they like when they come through the door, but use the opportunity of that consultation to bring it around to conversations about drug use, potentially looking at whether there are any drug-associated harms, motivation, a motivation for change, insight, as the last chap was talking about. So a bit of general medical care, drug and alcohol counselling from a great team of counsellors and social workers is a big part of the work with this population. But as you can see, we provide a wide range of different things that people may wish to access us for, and we very much use that as a way in to talk about the issues we're funded and perhaps have as a core issue, which is bloodborne viruses and drug and alcohol issues. So as well as the medical side, recognising that this particular population of young people often have a great deal of social and legal and welfare needs, we have a lot of support around getting people's medical and social needs met. So we also operate an Aboriginal program, and we're responsible for the delivery of needle and syringe programs right across the state. No, that's not true, across the health district. And we do some harm reduction stuff as well around naloxone overdose management for people using opioids, safer injecting workshops, and a lot of outreach. I'll talk a bit about that. So particularly with the at-risk young people at KRC, we recognise that they may have a lot of barriers in coming to a service in the middle of King's Cross. We found that using the really great relationships that partner organisations have already developed with many of these young people is often a really good way to overcome that barrier of being a standalone health service in that way. So a lot of the engagement with people occurs at outreach locations, and I'll talk about some of those first of all. We also recognise that for some young people who may be at risk of becoming maybe more street-based or developing further drug-related harms, bringing them and making them sit in the King's Cross Kirketon Road Centre waiting room with much older people who may have been experiencing drug and alcohol issues and for quite a long time can be quite confronting. And so we try to meet the needs of people where they're at in those outreach locations, but obviously we do sometimes need to bring people back to our main site for specific types of care. Now, one of the reasons for the outreach services as well is if we wait in our own service for young people to come in, they've often been experiencing harms for a year or two, or using drugs, for example, in a harmful way for a couple of years before they ever come across us. And so the idea of a lot of the outreach is to try and find people at a stage where there may be more opportunity for intervention, and the comfortability of the services that they're already engaging with really helps with that. So this is an example of the sort of places we're currently working. So We've got, it's typically nurse, counsellor and health education officers that go to these venues. So we go to youth services run by the Salvos in Oasis, down to Wayside Chapel Youth Programme, 2010 in Camperdown, and I notice a colleague of mine, Kate, used to work there for us, so hello, Kate. We also do more ad hoc health promotion and education sessions, and sometimes testing at places like Tednoffs in Randwick, Mission Australia, the PCYC run by the police in Woolloomooloo. And we've been evolving our youth network and relationships in Sutherland's area via our NSP service called KRC South. We also used to work at Headspace in Hurstville and Miranda, and at the one of the local schools that was a school for people who perhaps hadn't done so well at other schools before in East Sydney, but that school got closed. So a lot of the work that's done in these settings prior to engaging people in specific health or social care through our outreach is a different range of engagement approaches, I guess. So a lot of the counsellors and health education officers provide activities and games and projects and art and craft activities that can begin a conversation and perhaps be a much less threatening way of beginning to talk to somebody, gain their trust, and then bring the conversation around a little bit to whether or not our specific service has anything that might be of interest or of use to them. And that's some pictures of some various things that go on. We also, a few years ago, were involved in a project called the Prevention of Transition to Injecting project. And that was very much focused on trying to identify or intervene at the point where people were perhaps moving from, say, smoking or oral consumption of illicit drugs through to actually injecting. And that focused both on the young people themselves, but also the community of people who were already injecting drugs, and just asking them to reflect on their first experiences of injecting and how they felt about that now. And obviously not everybody shares the same view about that, but many of those people were able to identify that the moment somebody else maybe injected them, and they would wish to not be the person that did that to somebody else for the first time. And so that was quite a useful strategy, looking at both young people transitioning to injecting, but also looking at the other group of people, the older people, who were perhaps forming some bridging relationship into that lifestyle. So we also, frankly, also just provide financial support for people to be able to come to the service. So cab charges, Opal cards, and try very hard to make those barriers not the reason that somebody can't come. So I don't normally give that talk with my budget manager from the health district in the room, but no, I can't see him here. So we do hand out the odd cash to get people from their outreach location into the service if they need something specific. We also try and keep the young people fast-tracked through the service so they're not hanging in the waiting room, less opportunity to disappear. And although all the team at Kirketon Road, we've got about 65, 70 staff, although they're all able to provide this sort of care, we try and focus it in on a core number of counsellors and nurses and health education officers so that there's continuity and a skill set develops, and also the young people begin to recognise and trust those individuals. So I think that's probably my 10 minutes, but that's a summary of our service. We obviously work in a great deal of partnership with other drug and alcohol services and early psychosis services, and I can see many friends and partners in the room here today. I am going to stick around for lunch, and I hope that you have a really lovely rest of the day. So thank you for listening.